Good morning and welcome to Prostate Choice Zoom Cast. I am your host, Shelly Gordon. Today I am joined by Hugo Embert. He is the Chief Marketing Officer of EDAP TMS. EDAP is the company behind the medical device used for a procedure for men called High Intensity Focused Ultrasound, or HIFU. We're also joined by Dr. Brian Miles. He is the Vice Chair of the Department of Urology at Houston Methodist Hospital. Dr. Miles is also Professor of Urology at Weill, Cornell. So today we're going to be talking about the possibility of HIFU being covered by insurance, which makes it much more affordable to men with prostate disease. That's because starting January 1, 2021, a new CPT code for HIFU goes into effect. So Hugo, let's start with you. Tell us about this new CPT code and why it's so significant.
Our HIFU technology represents a very appealing option for patients to address the prostate condition while still preserving their quality of life. This is also attractive for hospitals and payers since it represents lower direct and indirect costs. The CPT code is significant because it will contribute making HIFU accessible to a much larger population of men with prostate disease. Reimbursement is a key component in making a medical technology available to the majority of patients. As a company, we worked hard to make sure HIFU was a worthwhile investment for hospitals and physicians. So once our HIFU device received FDA clearance for prostate tissue ablation, we immediately started down the path of reimbursement with a solid and aggressive strategy. We applied to the American Medical Association, the AMA, for a CPT code less than 2 years ago. Our application was granted a CPT Category 1 code, the highest and most standard code for medical procedures. This was achieved in part thanks to the support of the AUA, the American Urological Association, and the AACU, the American Association of Clinical Urologists. The CPT Category 1 code will be effective on January 1st, 2021. This is a major milestone reached in 18 months or so, which is the shortest time possible for this kind of process. A CPT code, a Category 1 code, means that both physicians and facilities, such as hospitals and surgery centers, can submit a claim for payment to Medicare as well as private insurers. And the price has already been set and made official by CMS. This now makes it possible for many more hospitals and urologists in the country to offer HIFU to many more patients and get covered appropriately by the payers. To date, Medicare in some states and national private insurers such as Aetna and Cigna already cover HIFU as a salvage treatment in case of cancer recurrence after radiotherapy. The CPT Category 1 code paves the way to expand coverage of HIFU for all patients who are eligible for this procedure. And as a company, we will continue our efforts to make this possible in a timely manner. In conclusion, HIFU is a short, non-invasive outpatient procedure. This represents obvious cost savings for the healthcare system. But in addition to that, HIFU also prevents the indirect costs associated with post-operative adverse events. That's because HIFU not only improves the quality of life of the patients, but potentially reduces long-term recurring health expenses to deal with those urinary and erectile dysfunction issues. This yields cost savings for patients, healthcare providers, and payers.
And Dr. Miles, how about you? How does this impact your patients, your hospital, your practice?
Well, I think, as David said, this is a boon for all patients who want to seek alternate treatment for prostate cancer other than traditional radiation or removal of the prostate. It's going to be embraced by many institutions, I think, throughout the country because it's an excellent alternative for patients. The drawback has been the cost, which in Texas has been around $25,000 before Medicare approved it. It is now paid for, and patients are lining up. I have 12 lined up in the first 2 to 3 weeks of January who have been waiting for this moment. These are men with intermediate risk cancer who can wait a couple of 3 months, and they're doing so just so they can get it paid for, because a few $1,000s even for Medicare, which is what it was throughout 2021, is a lot of money to most patients. And so the fact that Medicare covers it is a great boon to them and to practicing urologists who now have another tool in their armamentarium to manage these patients. So I expect we're all going to see a dramatic increase in the use of this technology and the number of patients who desire to have it performed.
That's great. Thank you so much. Thank you, all of you.